Honored guests, ladies and gentlemen, thank you for having me to address you today on some of the technical aspects of the occupational health and safety programs and how they impact in gaining access to global markets. Having built the largest cargo vessels ever made in Bangladesh, Western Marine Shipyard has been exploring markets in international areas. According to the government of Bangladesh, there is a realistic possibility of exporting small to medium category ocean-going vessels worth about $5 billion per year, $5 million US per year by 2015, which is a huge market. The investment in occupational health started in June 2009 when Western Marine Shipyard and GIZ entered into an integrated public-private partnership in collaboration with the Ministry of Health and Family Welfare. There were two interlinking objectives to that project. The one was to develop and introduce an internationally recognized occupational health and safety program, and the other was to set up a primary healthcare facility which provided emergency occupational healthcare and basic healthcare to the workers and the surrounding communities and the surrounding industries. There were various contributions to be made in that partnership. Western Marine, for its side, constructed, maintained and equipped a healthcare facility of high quality and recruited a medically qualified doctor and staffed the clinic. GIZ provided coordination and oversight. It provided technical consultants as required, and it developed and implemented a monitoring and evaluation system. The Ministry of Health and Family Welfare provided qualified staff for the primary healthcare facility and maintains a clinic stock of essential drugs. It also provides family planning and maternal health care, including immunizations from the facility. The injuries before the start of the program were massive, as you will have seen in the film that was just shown, up to over 1,000 employees injured in a single month. Now, if we work on the premise that 98% of all incidents or accidents are preventable, then we start looking at the causes. When at the beginning of the program, there was a disregard for safe work practices and for the wearing of personal protective equipment. And the result of that led to many injuries. The generally accepted accident ratios are that for every one serious injury, there are 10 minor injuries, and there are 30 incidents of damage to property and equipment. Now, the cost to companies of those 30 damaged equipment is significant, other than the human cost. When you look at injuries, they're what we refer to as a lagging indicator. They're a measure of failure. Systems that are put in place that prevent injury, such as OSAS 18001 systems, are measures of success, and they are the leading indicators, and they are the main thing that we want to measure. We have measured both over time and reported on them. What is the benefit of putting in such a system? It reduces business costs and disruptions. It enables enterprises to meet customers' expectations. And as Bangladesh is looking to export into countries in Europe, you will find that there's a great demand for safety, occupational health and safety to be there. It protects and enhances a brand image and your brand value. It enhances your employees' commitment to the business. It helps demonstrate that a business is socially responsible, reduces total health care, helps maximize the productivity of worker, and that they're more competent and more motivated and healthier workforce. Now, what are the benefits for the country as a whole? Preventive healthcare programs are included. Companies therefore help to carry the costs of health. It improves the image of the country in the eyes of investors to that country. It builds sustainable competitive industries within the country, and it reduces incapacity among citizens. Incapacity among citizens is a transfer of costs. It gets carried by the state. It reduces total healthcare costs to the state, reduces injuries, and ends up with a healthier workforce, taking pressure off state services. We've talked about OSAS 18001. So what are the elements of OSAS 18001? The first thing is policy. The company must show its commitment through a stated policy. Planning is an important part. If you don't know where you are now, you don't know where you need to go. So measurements against international norms are important here, and planning your programs. Implementation and operation is done in a very systemized way using project management approach. And then it's important for us to measure the outcomes and to correct things where things are going wrong, to put corrective actions in place. And very importantly, management must be intimately involved. There must be management review, and whereas lesser developed companies are looking only at the bottom line at profits, injuries and safety record becomes part of every meeting. And then you must aim for continuous improvement. In terms of looking at occupational health and safety maturity within organizations and with countries, we talk about a 5-stage model of maturity. In stage 1, companies are simply not aware. They don't consider that safety is a serious issue, and they don't think it needs to be managed. Reactive companies are not aware of the true complexity of work-related risks or appropriate solutions. Stage 3 are experimental. They're starting to put in place some sort of programs, but it's on ad hoc risk treatments in a way that is uncoordinated and poorly assessed. Stage 4 is systematic. It includes rule-based limits, and all elements of the risk management cycle is provided in a systematic way. And then we have global leaders. So what our goal was with Western Marine, who were on the border of reactive and experimental, was to move them into systematic, and that's exactly what I think has been achieved in a very short period of 2 years. The integrated approach. If we look at organizational health, there are various limbs. The health management limb starts with assessing your risks and putting elements in place to manage your risks, including medical surveillance. Your supportive limb is around on-site primary healthcare, emergency services, specialist services, and rehabilitation. Your promotive limb is wellness, health education, employee assistance, and incapacity and disability management. And then there is the strategic limb, which is around OSAS 18001 and ISO alignment, management of strategic issues such as HIV, AIDS, TB, etc., benefit management, and environmental management. And you will see that in the diagram that I'm showing, some of the blocks are darker. The dark blocks are where we feel we've put in place good systems. The lighter grey is where there's some progress, and the lightest grey is where we still have to move. So if we talked about the leading indicators and the lagging indicators. I showed you the injury rates when we started. When we measured the things that were in place in terms of policy and organization, planning, implementation and operation, corrective and preventive actions, management review, and overall performance, this is what we saw on the graph. This was in 2010. We put a system into place, and by the end of 2011, the overall improvement had improved from 4.7% to 34.5%, and this year on internal audit, this has improved to 72.4%. This is really a very dramatic improvement in the leading indicators. So one would expect to see an impact on the injury rate. And if we look at the injury rate, that's what happens. The injury rate has dropped dramatically from the high levels, and we will soon have to reset the axis of the graph because the injury rates are so low now, they're back into international norms. That's a picture of the primary healthcare facility that was built, high quality facility built by Western Marine. And from there, apart from the occupational health program, there's community health programs being driven. The use of the clinic facility in the last 18 months, you can see the number of visits there. Primary health care and care to employees and contractors, over 11,000. Community health, nearly 5,000. And then injury on duty, 2,300, and those are dropping daily. And medical surveillance, almost 1,000. I just wanted to show these two before and after pictures. You will have seen in the film they were talking about the kitchen. When we went to the kitchen, it was extremely hot, extremely smoky, very, very unpleasant place to work, and very poor health outcomes expected. When we put in extraction systems and engineering controls, this was the next day. You can see there's no smoke. People are happy. They are not. They were not able to wear shirts. It was so hot. Now they look perfectly comfortable. The audit was held in August this year, and that is the audit committee. And the result is OSAS 18001 certification and ISO 14001 certification. For those that don't know, that's occupational health and safety, the OSAS 18001, and ISO 14000 is environment. So what have the impacts been of this partnership? There's been an implementation of a systematic approach to health and safety, a development of a sustainable safety culture within the organization, dramatically reduced injury rates of more than 95% reduction in injuries, and the cost that would have had on the communities. Increased global competitiveness of business. OSAS 18001 certification is achieved. And I might add that in order for you to qualify for certain tenders in some countries, you have to have certification. There's reduction of environmental pollution with the ISO 14001 certification. And there's improved accessibility of health services to the surrounding communities. What opportunities does this present for us going forward? The results achieved are through a system which is reproducible, measurable and scalable, so it can easily be transplanted to the rest of the shipping industry and to other industries. This will provide industries with competitive advantage while benefiting the health of employees, a true win-win solution. We will be able to reduce injuries, disabilities and death, provide healthcare services to employees and the surrounding communities, and to positively impact on the environmental and thus health of the nation. The lessons learned. Leadership is indispensable. The leadership of Western Marine Shipyard was solidly behind the project, and without that, this never would have been achieved. The leadership from GIZ, likewise, without them, this would not have been achieved. Adequate resourcing is required. Strong project management is vital. Worker buy-in and participation is required. Without that, you're going nowhere. Skills transfer is relatively easy if a good framework is provided. As I said, this is reproducible. The payback is rapid, and the long-term sustainability requires maintenance of all of the above. And sustainability is important. These things mustn't happen and then fall away. Thank you very much.